Hey everyone, it's Dr. Ghag here. Today I want to take a couple minutes to talk about what a normal healthy period looks like and what hormones are actually involved in your cycle. So first and foremost, the whole point of a menstrual cycle is to prepare your body and uterus to carry a child. So there's actually three phases of your menstrual cycle. You have your follicular phase, ovulation, and the luteal phase. So as the name suggests, during the follicular phase, a few follicles are released from your ovaries and one is chosen to become the dominant follicle. As the dominant follicle, it becomes a target of a hormone called the follicle stimulating hormone, or FSH. So FSH's role is to help the dominant follicle grow and mature so it can actually reach ovulation, but it also helps stimulate the release of estradiol from the follicle. So estradiol is a form of estrogen, and we've all heard of estrogen and its benefits on our skin, muscle, heart health, and bone health. However, one of its main roles during the menstrual cycle is to thicken the lining of the uterus to help prepare for pregnancy. Another thing actually that it does is that it stimulates the release of fertile mucus, which is that thick egg-like discharge you may notice you get right before your period. This is actually a really great sign as it shows that you're nearing ovulation, as estrogen levels are highest right before you actually do. So as you get closer to ovulation and your estrogen levels increase, another hormone called the luteinizing hormone, or LH, is also told to increase. So with rising LH levels, or an LH surge as it's called, your dominant follicle ruptures and an egg is released. So the release of the egg is ovulation. And this is actually the shortest phase of your menstrual cycle, as it only lasts 1 day. So that ovulation window is actually very, very small. So here, after the rupture of the follicle, your luteal phase begins, and the follicle actually transforms into a whole different structure called the corpus luteum, whose main function is to produce progesterone. So again, here your body has two options. You either become pregnant or you get your period. If there is no chance of pregnancy, your corpus luteum will only survive for 16 days. So after these 16 days, both your progesterone and estrogen levels start to decrease. And with this decrease, the uterine lining starts to shed as it no longer has the hormones it needs to maintain that thick, healthy layer. So this shedding is actually your period, as we all know it as, and the first heavy day is actually considered day 1 of your cycle. So at this point, your cycle will restart and the follicular phase begins all over again to prepare your uterus for implantation in case it were to happen next month. So all in all, your period should last anywhere between 21 to 35 days, with your follicular phase averaging about 7 to 21 days, your ovulation phase only lasting 1 day and usually occurring around day 14, and the luteal phase going anywhere between 10 to 16 days. So if you're not really sure how long your period is and what your cycle looks like, a great way to track it is using a period tracking app. In these apps, you can usually record day 1 of your bleeding and how long your bleeding usually lasts. And from then on, the app can predict when you might ovulate. And also you're able to track your PMS symptoms, so you can just prepare your body for when that time comes. So it seems pretty simple, right? Good hormones equals good period. What you have to take into consideration though is that your hormones are affected by a variety of different things, such as stress, diet, exercise, environmental toxins, and any other health conditions that you might be dealing with. So because of this, women experience a variation of different periods, whether they may be too short, too long, too heavy, not occurring every month, or occurring too many times per month, and also taking into consideration PMS symptoms. The great news is that naturopathic medicine can assess all these different factors and help optimize your hormone levels using diet and lifestyle advice, supplements, and botanicals to bring you back to a happy cycle and a happy you.